Sprains and strains are two very common injuries that people experience, and there's often a lot of confusion about what these two different types of injuries are. So today, hopefully, I'll be able to kind of help you distinguish the two. And first, we're going to start with sprains. It's a stretching or tearing of the ligaments when a joint is stressed. Ligaments are tough bands of fibrous tissue that connect one bone to another bone in a joint. One of the most common examples that people experience of a sprain would be an ankle sprain. There are several ligaments around the ankle that can be injured. These can be injured if someone's walking or exercising and they happen to step awkwardly or land on an uneven surface and they twist their ankle. Another common location of getting a sprain would be in your knee. This can happen whenever you're running or walking and you plant your foot awkwardly, causing a pivot or a shift of your knee in an awkward direction. Another example of a sprain can be seen in the hand. If you happen to fall onto your hand and you possibly stretch one of the fingers or your thumb in an awkward direction, you can get a sprain of one of the ligaments. It is possible that if you have improper warm-up prior to exercising, that you might be slightly at increased risk for suffering a sprain. The signs and symptoms vary depending on the severity of the sprain. With a sprain, you may actually hear or feel a pop in the area of the affected joint. Likely to experience swelling, and you may experience bruising. You definitely will have pain, and oftentimes there's limited mobility of that joint. A strain, on the other hand, is a stretching or tearing of a muscle or tendon. There are two types of strains. You can have an acute strain or a chronic strain. For an acute strain, there's different degrees. You can stretch the tendon or the muscle, you can partially tear the tendon or the muscle, or you can completely tear the tendon or the muscle, and these can happen acutely. The most common locations oftentimes are the hamstring or the back, but it really just depends on the type of activity that you're involved with as to what you're most at risk for. A chronic strain is typically what we refer to as an overuse injury. It's something that results from prolonged or repetitive movements of a muscle. You may be at risk for chronic strains if you have improper warm-up before exercising, if you have poor conditioning, if you continue to exercise despite being fatigued. The signs and symptoms vary depending on the severity. With a strain, you may experience some muscle spasm, you'll likely experience pain, you may experience swelling, you may experience limited motion of the affected muscle or the joint that's involved with the muscle that's been strained. As to when you should see a physician to be further evaluated for an injury, I usually recommend that if you're not able to bear weight, if the symptoms are worsening over the first few days rather than improving, if you're not able to move the involved joint, or if there's any concerns that you have and you're just not sure, it's better to be cautious and safe and see your physician. If we suspect that there's been a strain, we'll examine the region that's affected. We'll look for swelling, try to determine which areas are the most tender. We'll also try to determine the intensity of your pain. Oftentimes in our exams, we'll move the affected joints and limbs in various positions to help us identify which muscle, tendon, ligament has been injured. In addition to examining you, it's very possible that the physician may feel that an x-ray is necessary. We may need to try to determine if there's an injury to a bone, such as a fracture. In some cases, we may determine that an MRI is necessary for us to best determine the extent of an injury or the location of an injury. A lot of times when there's been an injury, people can definitely start some basic self-care at home initially. Oftentimes people know the term RICE, R-I-C-E. So for the first part, the rest, ideally if you're having pain, you want to try to minimize motion at that joint or that body part, and if it's in a lower extremity, you want to try to stay off of it. For the ice portion of the treatment, we recommend, especially the first 2 to 3 days for sure, applying ice. And you want to apply ice for 15 to 20 minutes at least, several times a day, to try to decrease the swelling and inflammation to the affected area. The C stands for compression. If there is a lot of swelling that you're noticing in the affected area, you can get something like an ACE wrap and just apply a compression wrap to the area. And then the E stands for elevation. Especially if this is a lower extremity, you want to try to get the affected body part above the level of your heart to try to decrease the swelling that may occur after the injury. For all types of injuries, the first few days, it's definitely appropriate to monitor it and see how it's responding. If it's a more mild injury, it's something that'll often resolve in the first few days. and you can do a lot of the self-care treatment at home with the rest and the ice and the compression and elevation. You also could consider doing some over-the-counter medications, but for the milder injuries, if they're getting better over the first 2 or 3 days, then you can gradually get back to your normal activities. If there's anything that's just continuing to be a problem for more than 2 to 3 days though, you're probably going to fall into the category of more moderate to severe injuries. And if you're continuing to have a lot of pain, swelling, and limited use of that affected area, then that's when you're going to want to start to consider seeing a physician to try to get further advice and to determine a treatment plan for that injury. One of the things to always keep in mind as far as to try to prevent a sprain and strain would be having a good conditioning program. Always having a good regular exercise routine can be helpful. Also, trying to always make sure you warm up properly with good stretching techniques. These are some things that you could do to try to prevent injury.